In today's live broadcast, we're going to be talking about ear infection. Yeah, we'll be talking about ear infection. What causes ear infection? What are the simple home remedy for ear infection? We'll be looking at all that. Do not forget that in Gateway 101, we places emphasis on prevention because we strongly believe that prevention is better than the cure. So, whatever we are discussing today does not constitute diagnosis or treatment. So, we are only creating a healthcare awareness so that you can go and seek medical help. In Gateway 101, we also provide free medical transport for our community to see their healthcare provider. Yeah, so if you find it difficult to get across to your healthcare provider, keep up with your doctor appointment, contact us. We will assist you for your medical appointment. So we do this act of courtesy. It's our little way of contributing to the community that we live. Okay, this is Get Well 101. So in today's live broadcast, we're going to be talking about ear infection. So an ear infection is inflammation or infection of the ear caused by bacteria, virus, or fungi. Okay, so in other words, bacteria can cause ear infection, virus can also cause ear infection, and fungi, sometimes fungi, can also be a cause of ear infection. It can affect different parts of the ear. Do not forget, we have the outer ear infection, also commonly known as swimmer infection. We also have a medical term. The medical term for it will be otis externa for outer ear infection. So the middle ear infection, medical term will be otis media. It's an infection of the middle ear. Okay, so these are medical terms for ear infection. Okay, inner ear infection, less common but most severe. Okay, please kindly subscribe to Gateway 101. God bless you. Kindly subscribe to Gateway 101. Okay, inner ear infection, less common but more severe. So middle ear infection are essentially common in children. Okay, so what causes ear infection? So we're going to be looking about the possible cause of ear infection. So let's talk about the middle ear. Don't forget we have the external ear, the middle ear, and the inner ear. These are the three categories. These are the ears categorized, I mean to say. So is the infection affecting the outer ear, also known as otis externa, or the middle ear? Medical term will be otis media, or the inner ear. So what part of the ear is being affected? So let's look at the middle ear infection, also known as otis media. Okay, so it often happens after cold or fluid. So this mid-ear infection, otis media, commonly happen after cold or flu. Sometimes it can also happen after sinus infection. Sometimes it can also happen after allergies. It can also happen after blocked estotic tube. If the estotic tube, the middle ear tube, leaking to the inner ear, if that tube is blocked, you can also have ear infection. So the common causes will be bacteria like Staphylococcus pneumonia. It's one of the most common causes of mid mid ear infection, also known as otis media. So virus such as cold or flu can also cause the middle ear infection, also known as otis media. So otis media infection, which is the middle ear infection, could be caused by common cold or fluid virus. Okay, so when mucus build up in the eardrum, germs grow and cause infection. Yeah, sometimes you can actually have abscess in your mid ear. Sometimes the outer ear, the mid ear, but any infection in the inner ear is severe. Okay, so mucus can actually build up too if you're not properly taking care of your ear. Mucus can build up in your middle ear or behind the eardrum, so germs will grow and cause infection. So outer ear infection, what commonly known as swimmer ear, is often caused by water trapped in the ear. So if you have water trapped in your ear, this can also cause outer ear infection. Scratches inside the ear can also cause ear infection. Using cottons, if you scratch your ear or using cotton bulb or cotton swab too deeply into your ear, this can also cause outer ear infection. So earbuds that are not clean, can also cause outer ear infection. Okay, so moisture allows bacteria or fungi to grow in your ear. So the common symptom of ear infection will be you have pain in your ear, mild to severe, I mean to say. So feeling of fullness in the ear is also common symptom of ear infection. So if you're having ear ache, the pain might be mild or severe. Is also the common symptom of ear infection. You having hearing difficulty can also be a common symptom of ear infection. So drainage from the ear, like I said, there are some ear that you can have abscess in your ear, and when it bursts, you have a pus draining from it. So, and subsequently, the pain might relieve when the abscess burst. Okay, the pain you might have a relief because it will drain, the pus will drain off out of your ear. So this helps relieve the pain. If you have a fever, more common in children, it's also a symptom of ear infection. Dizziness, which is common in the inner ear involvement, is severe. So severe pain, high fever, swelling behind the eardrum, or hearing loss need medical attention. Okay, so some simple home remedy to help alleviate symptoms. Importance: this help alleviate comfort, but do not replace proper medical treatment. So we also encourage you to go to a medical provider to seek help. One, you can use to help relieve symptom of ear infection. You can, using a home remedy, you can use warm compress. Okay, place a warm, not hot, cloth over the ear for 10 to 15 minutes. So this help reduce pain and improve drainage. Mostly we have abscess that's already busted. Okay, rest and hydration. Drink plenty of fluid. Help your immune system to fight infection. So over-the-counter pain relief you can also help to use that. But I always encourage us to make sure over-the-counter medication is prescribed by your primary care physician. Okay, even though it is over the counter, you can go there and get it without prescription. I strongly encourage us to always seek medical advice before buying over the counter medication. Over the counter medication such as ibuprofen or acetaminophen, Tylenol, can reduce pain and fever. Okay, following dosing instruction carefully. So 4. Keep ear dry because outer ear infection. For outer ear infection, keep ear dry. Avoid swimming. If you have an ear infection, avoid swimming. Gently dry ear after bathing. Do not insert objects into your ear. Okay, elevate the head while sleeping. This help improve ear drainage. Use an extra pillow if the need be. Okay. Also, avoid this. Never pour oil or herbal drop into your ear unless advised by a doctor. Well, I've seen people putting castor oil in their ear, putting olive oil in their ear. Don't do that. Never pour oil or herbal drop into your ear unless a medical provider advise that. Don't do that on your own. Okay, so do not use cotton swab deep into the ear. Okay, do not use cotton. Do not know. I have seen several cases in medical in the ICU, people coming in here with cotton ball stuck in their ear. So do not use cotton bulb deep inside the ear. Okay. Now, do not ignore symptoms lasting more than 2 to 3 days. Seek medical help. So, when to see a medical doctor if you're having ear infection? So, we strongly encourage you to seek medical care if pain is severe. Seek medical help. You're having a fever that's above 101 Fahrenheit or 38.3 degrees Celsius. Please seek medical help. If there's pus, or bloody drainage from the ear, please seek medical attention. If hearing suddenly worsens, you can hardly hear head when people talk. It is becoming serious, so you need to seek medical help. The patient is a baby under 6 months old. Please seek medical help. So, see ear infection. Some ear infection need antibiotics, especially bacterial mid-ear infection. Okay, they need antibiotics for proper treatment. But like I said, in Gateway 101, we do not prescribe medication, neither do we diagnose. So we're only creating a healthcare awareness by telling you that if you're experiencing these symptoms of ear infection, seek medical attention. Okay, so we're going to be talking about, let's look about if the ear have a drainage and also dizziness and also hearing loss. So what are the possible causes or what can you do at this situation? So we'll say that pulse drainage, dizziness, and hearing loss together is not a simple ear infection. So if you're having all these symptoms in your ear, this might require medical attention because this needs medical evaluation as soon as possible. Okay, if you're having pulse drainage from your ear, you feel dizziness, you hearing loss, if you're having all these 3 symptoms, this is a very serious medical situation. So seek medical help immediately. This could mean these symptoms suggest severe mid-ear infection, otis media, with rupture. So if you're having pulse, dizziness, and hearing loss, this might suggest severe middle ear infection, otis media, with rupture. Pressure from infection can rupture the eardrum, causing pulse drainage. Sometimes people have abscess in their middle ear, and when that abscess ruptured or burst, you have this pulse drilling from the ear. Sometimes bloody pulse coming out from the ear as a result of that. So sudden ear loss can also be attributed to mid-ear rupture. Okay, sometimes pain improve after rupture. Okay, so let's say you have abscess in your middle ear, it can be very painful, but once it's ruptured, the pain might subside a little bit. But in that regard, once you may need to seek a medical help for proper prescription. You might need antibiotics. Okay, so like I said, this does not constitute diagnosis or medical treatment. We are only creating healthcare awareness. So inner ear involvement, which is most severe, if dizziness and hearing loss are present, it could mean infection spreading deeper into the ear. So this is serious. Okay, inflammation affecting balance structures. This can sometimes lead to complication if not treated properly or urgently. So go to urgent care for or ER immediately if severe dizziness, room spinning. You look at the room, you see spinning. If you're having these symptoms from your ER infection, this is severe. Go to urgent care immediately. Or you are having a high fever above 101 to 102 degrees Fahrenheit, we encourage you to seek medical help. If you're having a severe headache, okay, we also encourage you to seek medical help. Swelling behind the ear, we also encourage you to seek medical help. You having nausea, vomiting from dizziness, projectile vomiting, these are some serious symptoms. You need to go to the ER. Facial weakness, these are also serious symptoms, so you need to be addressed by a medical provider. So go to the ER or the urgent care to get proper diagnosed. Okay, the person is young or child. If it's a child, you also need to go to the ER. So what to do right now to keep the ear dry? Make sure you do not put drop or oil in your ear. I've seen people putting castor oil, what you call flaxseed oil, all sort of oil in their ear during ear pain. Don't do that. So don't put any oil in your ear unless it is prescribed by a medical doctor. And do not insert cotton bulb or cotton swab into your ear if you are having ear infection, because this might aggravate the ear. It might irritate the ear. So do not insert any object in your ear. Use acetaminophen or ibuprofen if you're having a severe to mild pain. Okay, then sit upright if you are dizzy. Sit upright. Okay, so why this need a doctor? You may need a prescription antibiotics, ear drop, or oral antibiotics if you are having all these symptoms I've just mentioned. So you need to see a doctor. Examination of the ear drop, you need to see a medical doctor to be properly diagnosed and treated. Okay, possible referral to ENT specialist if you're having all these symptoms. Okay, delaying treatment can risk losing hearing. Okay, if you delay treatment, if you're having all these symptoms, you don't want to go to ER or urgent care to seek medical help, you might lose hearing. The infection might spread and you might have balance complication. Okay, so let's look at the possible way to prevent ear infection. Let's look at the possible way to prevent ear infection, because in Gateway 101, do not forget to place emphasis on prevention, because we strongly believe that prevention is better than cure. We also create healthcare awareness. So ear infection, especially the middle ear infection, also known as otis media, are common in both children and adults. The good news is many cases can be prevented with simple habits. So let's look at how can we prevent otis media or middle ear infection. So prevent cold and upper respiratory infection. So prevent cold, because cold can actually cause ear infection. So prevent cold and upper respiratory infection. Most ear infections start after a cold. So wash your hand frequently. Avoid close contact with sick people. So clean and sanitize commonly touched surface. Okay. Avoid touching your face, especially your nose, eyes, and mouth. Without wash, make sure you wash your hand before you touch your mouth, your nose, or your eyes, because you might be touching contaminated stuff without knowing. And when you touch your nose, your ear, your mouth with a contaminated hand, you can get infected. So respiratory virus causes swelling that block the eardrum. So the tube connecting the ear to the throat, so leading to fluid buildup and infection. So, two, stay up to date on Vaseline. Get vaccinated. We place this emphasis on vaccination in Gateway 101. We strongly encourage you to get vaccinated. So, it's all about prevention because prevention is better than cure. So, make sure you're up to date with your vaccination. Vaccinate help prevent infection that can lead to ear infection. Okay, influenza vaccine reducing flu-related ear infection. So, pneumococcus conjugate vaccine is protect against common bacteria that cause ear infection. 3. Avoid smoking and secondhand smoke. Cigarette smoke irritate and inflame the airway, and the eustachy tube increasing risk, especially in children. So don't smoke around children and don't smoke if you're having ear infection because it worsens the situation. If you smoke, quitting significantly lower ear infection risk in your household. Okay, so manage allergies because allergy can cause nasal swelling and fluid buildup in the ear. So control dogs, mold, and pet. Use allergy medication if prescribed and keep indoor air clean. Keep indoor air clean. Okay. So 5, breastfeeding for baby. Breastfeeding for at least 6 months helps strengthen the baby immune system and lower ear infection risk. Yeah. So breastfeeding for at least 6 months helps strengthen the baby immune system and lower ear infection. Okay. So proper feeding position for infant. Yeah, so if you are feeding infant, make sure you position them properly. But avoid feeding baby while they are lying flat. Keep their head elevated to prevent milk from flowing into the middle ear. Okay, so 7, keep ear dry. Prevent swimmer ear. Keep your ear dry for outer ear infection. Dry ears gently after swimming or showering. Tint head to drill water. Okay. Use earplug when swimming. If prone to infection. If you are prone to infection, so make sure you use earplug when you are swimming. Also, avoid inserting cotton swab deep into your ear. I have seen several cases those days when I used to work in the ICU. I have seen people coming to the medical emergency room with cotton bulb dislodged into their ear. So avoid inserting cotton swab deep into your ear because there are several cases of cotton bulb dislodged into people's ear. Okay, so don't overuse cotton swab. I have just said that pushing object into the inner can damage the inner canal. Okay, so push wax, you can also push the wax deeper, which increases the risk of infection. So the ear usually clean itself naturally. So when you see that drillage coming up from your ear, mostly when you wake up in the morning, all you need to do is just use a cotton bulb and just gently clean it. Do not insert it inside because if you are doing that, you are pushing the wax deeper into the ear. So all you need to do is just use a simple, because the ear have its own way of cleaning itself naturally. So when you see that small drillage that comes the wax, drill out in the morning, or anytime you notice that, you use a cotton bulb to gently clean it. Don't insert it into the middle ear because if you are doing that, you are pushing the wax deeper. Okay. So strengthen your immune system. So eat a balanced diet, get enough sleep, exercise regularly, manage chronic conditions like diabetes. All this because any kind of infection might impact your ear. Okay, so see a doctor if you notice severe ear pain, fever, fluid or pus drilling from your ear, hearing loss, symptoms lasting more than 2 to 3 days, and If you have all these symptoms that I have just mentioned, please seek medical help. Very, very important. But for sake of you who are sake of those who are just joining us, we go to recap again. We recap so that we can carry everybody along. For those of you who are just joining us, we started by saying that an ear infection is inflammation or infection of the ear caused by bacteria, virus, or sometimes fungus. We also said that it can affect the different part of the ear. So we have three different parts of the ear. The outer ear will be also known as swimmer ear. The medical term is otis externa. Then the middle ear infection, the medical term will be otis media. Then the inner ear infection, which is less common but more severe if it happens or if it occurs, is also it also have its own way of harboring pain that are very, very severe. Okay, middle ear infection are usually common in children. So, what causes ear infection? We say that middle ear infection, otis media, often happen after cold or fluid. We also say that it can also happen after sinus infection or allergies, block middle ear tube. Okay, so common causes will be bacteria like Staphylococcus pneumonia, virus that will be cold and flu virus can also cause middle ear infection. So when mucus build up behind the eardrum, germs grow and causes infection. So we also look at the outer ear infection, also known as swimmer ear, and we say that it is often caused by water trapped in the ear. Scratching inside the ear can also cause ear infection, and using cotton swab too deep can also cause ear infection. Ear earbuds that are not clean can also lead to infection. So moisture allow bacteria or fungi to grow in your ear. We also look at the common symptoms. I would say that ear pain, mid to severe, feeling of fullness in the ear, hearing difficulty, drainage from the ear, fever, more cold in children, more common in children, I mean to say, dizziness, inner ear involvement. I would say that severe pain, high fever, swelling behind the ear, or hearing loss need medical attention ASAP. We also look into some simple home remedy to help alleviate these symptoms. I would say that this help relieve discomfort but do not replace proper medical treatment. So we encourage you to seek medical help if you're having any of those symptoms, and home remedy never alleviate the pain or the pain get worsened. So use warm compress. Place a warm, not hot now, cloth over the ear for 10 to 15 minutes. So this help reduce pain and improve drainage in case you have ear drainage. We also said that have enough rest and hydrate yourself. Drink plenty of water. Rest help your immune system fight infection. We also talk about over-the-counter pain relief. I will say that acetaminophen, ibuprofen can help reduce pain and fever, but follow proper dosing instruction. Okay, then we'll talk about keep ear clean and dry. For after ear infection, avoid swimming. So gently dry ear after bathing, and do not insert object into your ear. We also talk about elevate your head while sleeping. This helps improve ear drainage, and use extra pillow if need be. We also encourage you to avoid this. We say do not pour oil or herbal drop into the ear unless advised by a medical doctor. We also said do not use cotton swab deep into the ear, because if you're doing that, you're pushing in the wax and that might cause infection. Okay. We also said that do not ignore symptoms lasting more than 2 to 3 days. Seek medical help. And we also said that when to see a medical doctor, we said see a medical doctor, seek medical care if pain is severe. You have a fever of 101 Fahrenheit or 38.3 degrees Celsius. So seek medical help. If symptoms last more than 2 to 3 days, seek medical help if there's pus or bloody drainage from your ear. Seek medical help if hearing suddenly worsens, and also seek medical help if the patient is a baby under 6 months old. Some ear infection need antibiotics, especially bacterial middle ear infection. You might need some antibiotics to get treated properly. So we also say that if there's pulse or dizziness and hearing, then this is severe. It needs medical attention right away. So we say that severe mid-ear infection like otis media with rupture. So pressure from the infection can rupture the eardrum. So this will causing a post drainage, sudden hearing loss, pain sometimes will improve when or after rupture. Okay. So inner ear involvement, which is more severe. Okay, if dizziness and hearing loss are present, it could mean infection has spread deep or deeper into the ear. So inflammation affecting balance structures. These are severe. This can sometimes lead to complication if untreated. Okay, so go to urgent care or ER if you having dizziness, severe dizziness, like spinning. You feel that the room is spinning. These are severe symptoms. You need to go to the urgent care. Okay, higher fever above 101 Fahrenheit, seek medical help. You have a severe headache, you need to go to the urgent care. These are medical emergency. You're having swelling behind the ear, you also need to go to the ER. Nausea, vomiting from the dizziness, you need to go to the urgent care. You have a facial weakness, go and seek medical help. The person is young, is a child, you need to seek medical help. So keep the ear dry and do not put oil or or drops in your ear, and do not insert object in your ear. Use pain medication for fever and pain, and sit upright if you notice dizzy. Okay. So why do you need a medical doctor if you're having this symptom? Because it might need prescription. Antibiotics might be prescribed for all ear drop might be prescribed for you if you're having these symptoms. Examination of the eardrum is crucial, so the doctor need to look into that. So you need to see a doctor for you to be properly diagnosed. Okay, possible referral to ENT specialist. Delayed treatment can risk worsening hearing loss, spread of infection, and balance complication. Okay, so and we also talk about preventing ear infection. We talk about preventing ear infection. I would say that ear infection, especially the middle ear infection, causes called otis media are common in both children and adults. The good news is many causes can be prevented with simple habits. I would say that prevent common cold, and also prevent upper respiratory infection, because common cold and upper respiratory infection might cause ear infection or might lead to ear infection. So most ear infections start after cold or flu. So proper hand washing is encouraged. Avoid close contact with sick person, and also clean and sanitize common touch area. Okay. Avoid touching your face, nose, ear, eye, and mouth unless you washed and sanitize your hand, because you might spread infection if you touch a contaminated object or contaminated surface, and touching your face with those hands, those contaminated hands, you might be infected. So respiratory virus causes swelling that block the eustachian tube, the tube connecting the ear to the throat, so leading to fluid buildup and cause infection. So stay up to date on your Vaseline. We encourage you to vacillate. Okay, make sure you're up to date with your vaccination, because if make sure you're having a flu Vaseline, because this reduces flu-related ear infection. Pneumonia conjugated Vaseline, you need that too, because that protects against common bacteria that causes ear infection. We also said that you should avoid smoking and secondhand smoke, because cigarette smoke irritate and inflame the airway and the respiratory tube, including risk, especially in children. So if you smoke, quitting significantly lower ear infection risk in your household. I also said that you should manage your allergies because allergy can cause nasal swelling and fluid buildup in the ear. So control your dog's mold and pet. Use allergy medication if prescribed and keep indoor air clean. So breastfeeding of baby. So breastfeeding for a less than 6 months helps strengthen the baby immune system and lower ear infection risk. Okay, proper feeding position for infant. Avoid feeding baby while they are lying flat. Keep the head elevated to prevent milk from flowing into the middle ear. We also said that you should keep ear dry, so prevent swimmer ear. For outer ear infection, we encourage you to dry your ears gently after swimming or taking a shower. Tint your head to drip water out. So also use ear plug when swimming if you are prone to ear infection. Use ear plug. Okay. Also avoid inserting object into your ear. Don't overuse cotton swab. Okay, pushing object into the ear can damage the ear canal. It can also push the wax deeper and also increase risk of infection. So the ear usually cleans itself naturally. That's what I said. I said if you have the wax draining out from your ear, don't push it in with a cotton ball. All you need to do is just use a cotton ball to gently clean the outer part of it. Don't dip it into the ear because if you're doing that, you're pushing the wax deeper. Okay. And I also said that strengthen your immune system, eat a balanced diet, get enough sleep, exercise regularly, and manage chronic conditions like diabetes. Okay. So seek a medical help if you notice a severe ear pain, you're having a fever, you're having a fluid or pus drilling from your ear, you're having a hearing loss. Symptoms lasting more than 2 to 3 days, seek medical help. Okay? Do not forget that while all this does not constitute diagnosis, or treatment, we are only providing you a healthcare awareness because that's what we do in Gateway 101. We provide you a healthcare awareness. I will give you a prevention tips because we strongly believe that prevention is better than cure. Thank you all for watching. This is Gateway 101. But we'll come your way again. Bye for now and God bless. Thanks. Bye bye. Good night.